Welcome back to Balancing Chaos with
Kelley
and Gretchen. And this week we were able to interview one of my friends, Deborah, about her experience with metastatic melanoma. And when I asked Deborah if she would be part of this, I said I was excited to share her story, but I said I really wish we were talking about your life in New York City or your life as a librarian or literally anything else other than what it's like to have a metastatic cancer. She has a really important story to tell. I don't like to say great because it's not great, but it's important. And hopefully you will be inspired to throw on that sunscreen, put on the hat, and be more knowledgeable about melanoma.
I'd say a positive side of the story is that when I asked Gretchen how she knew Deborah, she said, "Oh, she's my computer friend."
I have a lot of computer friends, but we really appreciate Deborah taking the time to share her story, and we hope that you take the time to hear her story. So today we are joined by Deborah, who has a very important story to tell, and I wish she didn't, but Deborah, can you introduce yourself and tell us about your story?
Sure. Hi, I'm Deborah, and currently live in Brooklyn, New York, but I'm going to be moving to the Washington, D.C. area this summer with my family. I'm 46, and for the past 5 years, I've been dealing with malignant melanoma and metastatic melanoma. Which was caused by childhood sun exposure and sunburns. I have 2 sons, ages 11 and 8. And so since I've been dealing with this for 5 years, I think that they probably don't really remember a time when I wasn't, sick. So that kind of sucks.
Whenever I hear about people, and honestly, especially with melanoma, because I feel like, in Maine, we don't get a ton of sun exposure. So I'm always wondering, how do you...
Well, there's tanning. People do tanning.
I have a whole rant about that. Because she and I both work with college students. Your nursing students probably do. You have some?
Not really.
I have students that rave about tanning, and I'm always like... It's like coming in and saying, I just smoked 3 packs of cigarettes. I feel so much better now. And it's like, no.
Yeah.
But how did you first discover, what made you think you might have a problem?
I started going to a dermatologist probably, I'd say in my early 30s, because my dad had always had a lot of skin problems. He was going to the dermatologist regularly. He had never had melanoma removed, but plenty of things removed. And I realized that, being as covered with freckles as I was, that I should probably, and, being a redhead, I should probably, get checked out. So the very first dermatologist I went to see in New York, she was kind of a kook. But she saw me, she looked at me, and she just started screaming at me. She said, "All these freckles, you shouldn't have these." She said, "All of this is sun damage. And, you never should have been in the sun." And, "Did you get sunburn as a kid?" "Yeah, sure, I got sunburn as a kid." So it was like, I thought, all right, well, if I just, go to the dermatologist, fairly regularly, then I'm going to be okay because they'll catch whatever it is. And so then when I moved to Brooklyn, I switched to a different dermatologist who was closer. And so there was this spot on I had all kinds of stuff removed and it was never anything. And I had this spot in the middle of my back, so really right where like the clasp of your bra would hit. And it was just kind of red and raw. And so, eventually my dermatologist was like, "Yeah, we should take a look at it." So he biopsied it and it was fine. And then it never really healed up. Like, it was just in that spot. And I was like, oh, maybe it's my bra that's like whatever. And like I would lie on top of that spot, like when I was over the like exercise ball at the gym, and I just always, so a couple of years later, he's like, yeah, well, maybe we should check it out again. And it turned out that it was melanoma. And, they tell you all the different signs that you should, check for when you're looking at an, irregular mole. And most people think that melanoma is just like this big black spot that shows up and it's irregular shape or whatever. But this was just skin that didn't heal. And that actually turns out to be an indicator of melanoma as well. So I got those results. I was referred to a surgeon at NYU Hospital and had surgery, and they did a sentinel lymph node biopsy to make sure that it hadn't spread to my lymph nodes, and it hadn't. But what the pathology report said was it was melanoma in transit, which meant, there might be cells on their way to doing something bad. So I had 5 sessions of radiation after that. And that, then I was good. So that put me into July of 2013. And then they scanned me every 6 months after that. And I was okay until September of 2014. I had a CT scan and they found spots on my lungs, and then they did a lung biopsy, and that's like a whole aside I can talk about, because following a lung biopsy, sometimes your lung can collapse, and so they keep you for observation for a couple hours. And I was fine, so I went home, and then the next morning I walked my kids 2 blocks to school, and I was so out of breath, and I called, and they're like, yeah, you should come in. And I had to be in the hospital for 36 hours because my lung had collapsed. Anyhow, so then I was referred to a medical oncologist, and she said, you know what, your timing is amazing, because this was fall of 2014. She said, if you had come here, 2-3 years ago, for years, there weren't any effective treatments for melanoma. They would try chemo, but it largely was not effective, and it was just killing people. It's still killing a lot of people today, but there's been a couple of game changers, and one of them is something called immunotherapy, which is they treat you with a type of, I'm not going to get too far into the science or I'll paint myself into a corner, but basically the way that immunotherapy works is that it removes the brakes on your immune system. There are things within your immune system that under normal circumstances are switched off, and it kind of switches them on. And what that does is it empowers your immune system to kill the tumors, which is amazing. And when it works, it's great. But the problem with monkeying with your immune system is that it can also have unintended consequences. So because I was at a research, a cancer center where they do research, I was also enrolled in a study to see if combining the immunotherapy treatment with a short course of radiation to the lung might boost the effectiveness of the immunotherapy. So they gave me my first infusion of immunotherapy, and that first week I also had 5 sessions, 5 daily, a daily session of radiation every day that week, radiation to the lung, to that specific spot. So I got through that fine. And then I got through the second infusion of the immunotherapy drug fine. And then before I was able to have the third one, I developed colitis. And that's a known side effect of immunotherapy. It's quite common. And it was really bad. I was just in agony for 3 weeks, lost 15 pounds. It was just terrible. It was really I can't even believe that I survived it, because it was really just it's so hard on you when you can't eat anything, when everything that you think you could eat is just turns against you immediately. And so it was rough. So they finally realized that I was in really bad shape. I mean, they're very much on top of the side effects and things. And so they had to give me an infusion of something called Remicade, which is given to people who have colitis. But what that meant was, once I had that, there was no going back to the immunotherapy treatment. Like, that was not an option anymore. So I got better that year, right in time for Thanksgiving, which was amazing, because I had even, like, we always have a big Thanksgiving at my uncle's house, and, my cousins, I have a lot of cousins, and I had actually emailed everybody in advance and, like, I'm coming and, like, I'm doing better, but please just don't ask me about food or, like, ask me if I can eat such and such. Just, like, let's not go there. And instead, I showed up for Thanksgiving and I, like, ate everything but the house. I was like, it was the best meal of my life. I had been starved. And I was finally able to eat everything. So, so that was great. So I think so that was November. And then in January of 2015, I had another scan of a CT scan, and all the tumors were shrinking. It was all just going the way it should. And that was with half of the course of treatment. So I think that they probably had a good idea that the radiation would make a difference. I'm glad that I was randomly selected to get it. I had been having a couple of headaches, and so in that same time when I had my CT scan in January, they did an MRI of my brain, and everything was fine. So they, they thought maybe it was because I was coming off of the steroids, or, and then, so that February of 2015, I started a job. I used to work as a librarian, and I quit my job when my older son turned a year old. And then the economy tanked, and I hadn't been able to get back to working as a librarian for years. And then I was given a chance to, it was a temporary position at an academic library. So I went to work there for the spring semester starting in February. And I was so happy, even though it was like an hour commute on the subway each way. It was just great. And there was, a possibility that maybe they, would hire me on full time. And so, so it was great. And then I just started feeling really tired. Like, would come home from work and just could barely move. Headaches again. So in April of 2015, I had another CT scan. And the morning that I was going in to get my results from the CT scan, that's the CT scan of my lungs, I woke up and I realized I was having trouble finding words. Like, wanted to say something and I couldn't remember really basic words. And I went to work and I, met with students and almost was like using sign language because which I don't know to communicate with them. In the afternoon, I went to see my oncologist, and I saw her and her nurse practitioner in the hallway, like jumping for joy. And they came and they told me I was NED, no evidence of disease in my lungs. And I was so happy to hear that I didn't mention that I'd been having any trouble with my speech. And the next day I went back to work, and again, was meeting with students and having trouble talking. Maybe I was slurring my words also. And so I was in a staff meeting, and, I had called my oncologist. They had to call me back. I was in a staff meeting, and they called me, and they're like, get your butt to the hospital. right now. So I'm a pretty stubborn person. So what that means for me, like when I had to, have, when my lung collapsed, I took the subway and the crosstown bus to the ER, and so they told me to go to the hospital right away for an MRI. And what that meant to me is go back to the staff meeting, wait till it's over, ask colleagues to cover the meetings I had set up with students for that afternoon, keep a lunch date with a friend who had just lost her dad, and then go to the hospital. So that's what I did. And they did an MRI of my brain, and they found 9 tumors.
Wow.
One of them was 3 centimeters in the area that controls speech and language. And that was, I had a brain MRI 3 months before, or 4 months. Anyway, this stuff is so sneaky and it can come on so quickly. And it was, I couldn't believe it. So they kept me overnight for observation at the hospital, and the neurologists were coming in every hour to ask me who the president was and all that stuff. And by the next morning, they released me and sent me back to my oncologist, who handed me a bottle of pills. And this is where I've often said that my experience of cancer has been like Alice in Wonderland meets sci-fi. And that was literally like, you go see your doctor, she hands you a bottle of pills, she's like, take these, like, drink me, eat me, She's like, I'm like, what is this? She said, well, remember when we did the biopsy of your lung? I'm like, yeah. She's like, well, we genetically sequenced your tumor. So even though we didn't need that information to treat the lung metastases, now we know already which mutation of melanoma you have. And that's really important because there are several different types. So knowing that, they had this type of treatment, which is called targeted therapy. What targeted therapy does is, number one, which is so important, it penetrates the blood-brain barrier, and it's, a match for the specific mutation of melanoma that I have. And so it goes in there, and like the effectiveness is such that like within days, my speech had improved. I was not having the trouble, like within days. It was crazy. Of course, I was also on steroids and other things, but so I was on just one of the targeted therapy drugs. And I went home and I had this bottle of pills and I took them for 6 weeks, and they did another scan, and everything had started to improve. All the tumors had begun to shrink. And at that point, this was early June. Actually, I think it was just yesterday or the day before was the 3rd anniversary of my gamma knife surgery. So I had laser brain surgery, which is another sci-fi kind of thing where you're lying in this tube that's kind of like an MRI machine, but it's completely silent. There's just a couple of soft beeps. Like I was able to listen to like quiet classical music. And your surgeon and, the physicist are like in the other room wearing suits, like at a computer. Just zapping. The gamma rays are the weakest type of radiation. And so the way that gamma knife works is that it concentrates hundreds of those rays targeted to the specific area of your brain, so that it only zaps the tumors and it doesn't zap your healthy brain tissue. So they do an MRI right before you go in, and you have the only weird thing is that they do bolt this frame to your head so that your head absolutely won't move, so they can be as precise as possible.
It sounds almost like, when you say the sci-fi, it sounds almost like a scene from A Clockwork Orange or something, with the soft music playing and the suits and the frame.
Yeah, it was totally crazy. So like the first time I actually had Gamma Knife twice. Then the first time they sedated me a little, but I was just like fine. And I was so excited about the whole thing. And like, so then I wound up having to have it again that November because there was, on my MRI, there was one spot that showed bleeding. And when I've learned about brain imagery is that if there's bleeding, there is no way for them to tell what that is. And melanoma tumors tend to bleed a lot. And so, but they also bleed when they're being starved out and dying. But there was no way for them to tell what it was. So I went back for Gamma Knife for that one spot that they had seen. And it was like a real judgment call for my neurosurgeon because he consulted with his colleagues and all of them were telling him that he should cut. And he is a Gamma Knife, you know, world-renowned Gamma Knife specialist. And he's like, we're going to give this a try. And I'm so glad that I didn't have to have anything invasive. And it has, you know, knock wood, it has worked now for, it's almost 3 years since my last Gamma Knife. So
can I ask a question about the
sorry
about the targeted therapy? So was that part of the clinical trial, or is that?
No, and that's where I've been so lucky is that when I have needed these treatments, they're no longer in a trial phase. They're approved. You know, so the one targeted therapy drug that I took, it was working great, but those drugs also have side effects, and I'll never understand why so many people, you know, go on these medications and they just can't stay on them. One of the most common side effects is really high fever. Like you wind up in the hospital with fever, like 104 fever, and you have to go off the medication. And I know a lot of people that's happened to. It happens all the time. But I have never, not once, dealt with that. Never had a fever, never broken a fever. However, what happened when I was on just the one targeted therapy was I had the souls, because of the pathways along which this therapy works, it also will have effect on your skin. And I had a thickening of the soles of my feet. It like really bad calluses, but like way worse than that. And it was not from walking, but just coming from inside like this. And so it was super painful. And so at a certain point I had to start taking another targeted therapy. So now I'm on a combination therapy. And the crazy thing is you're taking 2 medications and you would think that the side effects would duplicate, but they actually cancel each other out.
Oh, wow.
So that adding another targeted therapy actually helped the condition of my skin. It was really, it can also, targeted therapies can cause new primary skin cancers to develop. So you always have to be on your guard. And then because it seems to be my condition in life that I always seem to be like the outlier in every situation, the thing that has bothered me the most since I've been on targeted therapy, and I'm still on it, is eye side effects. I developed iritis, which is the inflammation of the iris of the eye. And the first time, I think this was when I was still just on the one targeted therapy drug, the first time I got it, it was like, I woke up at like 5 a.m. I felt like someone was stabbing me through the eye. It was so painful. So, you know how many people in the trial group got any kind of eye side effect? It was like 1%. Literally one person in the trial group dealt with this. So like, you know, my oncologists even haven't seen it that much. So I really had to I had to go to my ophthalmologist. Luckily, I'm a librarian and I know how to use PubMed. And I downloaded a couple papers. I'm like, and there had been at that point, luckily, a paper or two about the ocular side effects of these treatments. And here I am teaching my ophthalmologist, and he, to his credit, was like so willing to learn, took a photo of me, asked if he could talk about me to his students. And like, you know, it was a wonderful thing. It like was this partnership. You know, I had to see a retina specialist for a while because I had, you know, inflammation. Anyway, so that was annoying. But like I got to the point where when I had a flare-up of iritis, it would be managed because now I just keep steroid eye drops around the house all the time. And so if I sense that that's what's going on, I can start using the drops before I even go see the eye doctor. And, you know, so that's been really cool, is to like, to help a doctor develop their own knowledge so they can help other patients eventually. But like the, you know, the likelihood it's ever going to come up for any eye doctor is so slight because it's such a rare thing.
But think about how great it will be when it is that one weird thing that shows up with a patient who doesn't have that research background, to be like, oh, you know, what's going on? People will say, oh, I know exactly what it is. I'm very big on, so Kelley is a nursing professor, and and I work in higher ed and have, and my office is actually in a library, so I have access to all the journals and stuff. And I love having access to those research tools and having access to other researchers, because whatever it is, it's so nice to be able to have that information. But I think that a good, you know, I think that a doctor should not be intimidated by someone finding, you know, especially if you can understand the difference between peer-reviewed research and, you know, the Google, straight Google, and ending up with other things. But if you can come in and be like, here, peer-reviewed, what about this? I think that's helpful. So
exactly.
Well, I've struggled with some hormone imbalances since I had my children, and both my OB and my primary are very interested in everything I read about it, because they have so many patients with hormone disruption, and there aren't clear-cut solutions to that. And you know, hormone therapy is dicey sometimes, so I found that they were very open to it.
Oh, good.
I think it's a good sign of a good doctor to be open to that.
They're willing to learn.
For sure. Yeah, as we're moving now, I'm like, oh God, now I have to establish relationships with, I still haven't called. I've been like holding off on calling our health insurance to see whether they would actually let me stay with my oncologist up in New York, because it's unlikely. I mean, why would they let me see someone who's completely out of the area? But I have such
well, we can tell you from being
love for my oncologist, her nurse practitioners. We love each other. Every time we see each other, we tell each other how much we love. You know, it's like I lucked out so much with my oncologist. She's one of a kind. She has an undergrad degree in nursing. There's not a lot of doctors. Yeah, she's a DO, not an MD. But she wanted to be in the cancer field from when she was in 3rd grade and read about cancer in the Weekly Reader.
Oh, wow. So we're rural.
She's so inspiring.
Because we're the country mice here, because I always joke with Deborah about country mice, city mice. I can tell you that, I mean, so many people, like getting permission for treatment in another state for us is actually pretty standard fare, because the nearest metro area is Boston. So I'm hearing about all these treatments, and I'm wondering, would we even be able to access that up here, or would it require a trip? Or
we actually have.
We're only now, recently though, with the cancer center.
Yeah, because they're connected with Dana-Farber now.
Yeah,
that's brand
really
new.
The thing is, and what's so scary, I'm on this melanoma support group on Facebook that's just massive and like worldwide, and like it scares me so much when I see people posting who are clearly like hundreds or thousands of miles away from a bona fide cancer center, and like thinking that, you know, their dermatologist can treat that. No, you need people don't understand that melanoma is really, it can, be dormant and then it can come back 20 years later. I lost a friend last fall, and that happened to her. She was first diagnosed when she was 17. And then, for 20 years, she was fine. And then it came back.
Well, even here,
And the treatments we were on, she found me. She lived in Northern Ireland. And she found me through a blog that I started writing. And she was so happy to have someone to talk to because we're on the same targeted therapy. And she was the very first person in all of the UK and Ireland to be approved to get, and that's been another eye-opener for me, is how, we talk so much in this country about how we really should have a national health service. And then you start hearing stories about people who do live in a place where they have that, and they have to get compassionate approval for the drugs that I get with no problem. That it just, access to this type of treatment is more difficult, and it's just, they have to wait a month after getting an MRI to get their results and see a doctor. I'm just, there's gotta be.
Part of that problem, and we've talked about this too with the Affordable Care Act, is that it's, you make a plan for something. It's like anything. You say, let's say we just say tomorrow, everyone agrees, yes, let's do universal health care. It would be less expensive, more efficient, etc. But we don't have the providers. We don't have enough nurses. We don't have enough respiratory. I mean, we don't have enough healthcare professionals. And so we have to go all the way back and figure out how we're going to fix healthcare education, how we're going to open up access to residency programs, how we're going to get clinical sites for nursing students. So I think that's the issue in those states. Everywhere in the world that I know of is facing nursing shortages and probably provider shortages too. I'm just not in that world as much. So I think that's the big challenge. And that was always the debate in Massachusetts when they made it some universal health care there. Then there were waits in primary cares for months and months and months. You couldn't get in because there's not enough people.
Demand.
And we don't even have, I think I remember I have seen a dermatologist twice, and now I feel like I should see them more often.
Yes, you should.
But I saw one for an issue I had, and he was about 112 years old, and his office was in in this old house by the hospital, and you went in the back door, and it was
my God,
creepy.
The back door.
Yeah, so creepy. and he was, and it was in an intimate part of my body. It was like the most, and I was pregnant.
God, I know.
It was awful. Anyway, and he retired or died.
When I was training for a bike ride to fundraise for immunotherapy, and I was riding, and all of a sudden I had this crazy thing down there, and I had to go to my dermatologist, and I was like, oh God. You're not biking? I'm like, yes.
I actually have a mole in a very hidden place, and my OB is always like, she's Italian, so she's like, have your husband keep an eye on that, okay? I'm like, oh God, okay, well, can't you just check?
Yeah.
But and then I went to another one, and actually I think it was after your initial diagnosis. I remember being in my office, and I kept feeling this mole on my head, and it was just weird, and it hurt, and so I was like, you know what? I'm just gonna make the appointment. I'm gonna go, and I went, and it was fine. It was nothing, but I've never been back. But I only know of one other. That's the only dermatologist that we really have.
Oh, the waits are. I was referred to one once, and it was an 8-month wait. And by the time my appointment came, the rash was gone. And
the derm that we have is actually is kind of specific on his site that it's for medical, not cosmetic dermatology. He kind of makes it clear that, I forget how he words it, but it's sort of, don't come here looking for Botox dermatology. It's more actual skin health or something.
I don't know if you saw, Gretchen, I just posted a photo I was at my dermatologist this morning actually getting something frozen. And there's they've started something called cool sculpting.
Yeah.
that is like where they freeze your fat cells, and I don't know what they do with the fatsicles, but anyway, I took a photo of the display in the waiting room because it's just so absurd. And like, my dermatologist, he's in practice with his brother and sister who are also dermatologists. So I initially had started seeing his brother, but then I started not being able to get appointments with him because he is like big in the hair transplantation world. So everybody wants to see him for that. So I don't think he even practices like regular dermatology. So I see his brother, who's much less like,
in demand.
In that.
Less cosmetic.
Yeah.
So can I ask you a question about your childhood sunburns? Did you ever wear sunscreen?
We had some sunscreen around, I guess. I don't remember applying it very, I remember, I guess I wore hats, but, having this kind of hair, it was hard to find a hat that fit and stayed on my head, and was just outdoors a lot. And like, I'd get a sunburn and it sucked. And then I would get another one. I remember times when I would like intentionally like go to the backyard and like lay out.
Oh yeah, baby oil, Hawaiian Tropic.
Not baby oil,
no.
never. But oh my God.
We used to do that. And see, up here, I don't remember. The only time I ever remember using sunscreen was when I was 16 or 17 years old and we were on a Florida vacation. And we used it, and I remember my sister got sunburned, and you could see it on her back. There was a handprint from where whoever was rubbing it in stopped.
Oh.
And I remember we had to help each other get undressed because it was the most horrible sunburn we'd ever had. But up in Maine, we both were very, I kind of have olive undertones, so we just kind of tan. But I remember having tanning lotion, but I never remember sunscreen until I was really an adult.
Yeah, there was like some copper tone, 15. I think we had it. We probably had the same bottle for like 5 years.
Right.
Whatever.
So what do you do with your kids now?
Yeah. I worry. I browbeat them. They wear long sleeve rash guards in the pool. Hats are non-negotiable before they go to school in the morning. If it's going to be sunny, they got to put on sunblock. They went to overnight camp last summer for the first time, and I sent each of them like 3 full bottles of sunblock. And I know that it's so much easier for kids to have the spray stuff, and then they were talking about how the spray stuff isn't good because whatever. So, I just sent them with lotion. They knew how to put it on. They came back with these bottles unopened. Ooh. And I freaked out. I really did. I was really upset.
Yeah.
And I gotta say, one of my kids, has more of the tendency to tan. He has more like my husband's complexion, and one of them is just like me. And so, I told him, you can't do that. He was good. We post photos every single day, so I could see he was good about wearing his shirt in the pool. But, I gave them good sun hats, but of course they wanted to wear their baseball caps because that's what everybody else was doing. So I got in touch with the camp and I told them how disappointed I was. And they were shocked to hear about it. I guess they hadn't really been following closely. So I I've been in touch, and they were back in touch with me a couple weeks ago, and I referred them to a couple different associations that can send them materials for their training. And I told them, if you're going to spend as much time as you do, worrying about allergies, this is just as much of a health issue.
Yeah.
And it's not something that you can afford to ignore. So, if you're going to make every kid come to camp having had the meningitis vaccine,
right,
which we have to, even my 8-year-old had to get it. Yeah. You can't just drop the ball with sun safety. You just can't.
Yeah,
I'm hoping that this summer there'll be more.
All of my son's preschools have been fanatic about sunblock. So they apply it. It's a routine. So it's actually helped my kids be much more aware themselves, even when they're not at school, that they need sunscreen, and they don't fight it at all. But this story this is why I'm crazy about child health, because it's so easy to not see the consequence of our actions with children, because often the disease or the issue doesn't manifest until they're adults. So I think there's not as much motivation. It's not the cause and effect isn't as immediate. And this is why I get wound up about the lunches and recess and coping strategies in schools and sunscreen and the spraying of the...
I've been freaking out about, so we don't have an iPad, but my in-laws have iPads and my mom has an iPad now. And like, you know, so the kids are constantly on them and like propping them like on their crotch. And I'm like, guys, get that away from there. And it's like, you know, you'll thank me later. Yes. Get that out of your, you know.
Area.
Oh my God.
Well, there's a debate about the tick spray at the school. It got out of hand in the thread.
We have a lot of ticks up there.
We do. And obviously Lyme disease is bad too. So it's like you just said it about the copper tone spray sunscreen. So that has warnings that it can have carcinogens. It's not good for the environment. So it's a slippery slope, because you don't want a sunburn, you don't want cancer, you don't want ticks, you don't want Lyme disease, but you also don't want the chemical, because that also can cause cancer. And people don't understand that. And cancer is gonna climb beyond cardiovascular disease. It's the second most common cause of death. And we have so many carcinogens all over the place, but the cause and effect is so difficult to pinpoint that they're not as passionate about, you know, if you're motivated and passionate about carcinogens and making the environment better, people think you're like a crazy hippie, you know? And that's what was happening in the thread. It's like, well, you can have Lyme disease mitigation without spraying toxic chemicals. Like there's a balance. So anyway.
Yeah. No, there's actually, I've been seeing headlines about, you know, certain types of sunscreen that are now, they're finding are responsible for the deaths of coral reefs. And it's like, oh my God. How do we get back to like, I don't know. I remember I went to a presentation, I think it was last year, about melanoma, and there was a dermatologist there who was showing, you know, just the sort of increase in melanoma correlated with like what people wear, you know, and how like, 100 years ago, we weren't seeing this as much because people covered up, and like, you know, in communities where people dress modestly, they're not going to see as much melanoma because they're not exposing themselves to this.
Well, yesterday we had, and Kelley was there too, but we had a Kids Bop concert came to our and we have this so at the Waterfront Pavilion, which is an outdoor venue, and we left here and we all like put on a coat and everything and went down, and then I realized once we got down there we were like in the blazing sun, and I was like, girls, did Daddy sunscreen you? And they were like, no. And I was like, so I was like, there should be like, but it was with Maine, I think it can be kind of hard because we spend so much of the winter indoors that it doesn't you have to like get into the season. Like I have to get, and I actually have this hat because of you, I have to tell you, Deborah. But I have been really moved by your story and scared straight a little bit because I'm not someone who burns. So I have always sort of seen sunscreen as like a burn preventative more than a cancer preventative. And now I see it differently, but I have this big hat that I got, and it has a little neck flap, like the archaeologist neck flap. And I wear it when I'm gardening, and I wear it when I take it to the beach, and then I'm under an umbrella at the beach. And then I actually have a really light towel that I put over my legs at the beach now. Like I am like, it has totally made me change things that I do.
Big cabana that we put up at the beach. It's just this massive.
Oh, I have one of those for the beach without the umbrella. Like there's the beach that we go to has umbrellas built in, and then when we're at different beaches, then I have a special beach tent.
I was horrified to learn that there's a beach down not far from where we're moving to, where they have outlawed these beach cabanas. Because they're an eyesore.
Oh my gosh.
I was like, okay, number one, Are you crazy? Number two, like, your beach is not nearly as beautiful as Cape Cod. And no one has ever given us a hard time about that on Cape Cod. You know,
right.
like, if you've got an ugly beach, I guess you don't want, cabanas on it. But, oh my God, I couldn't believe it. Like, what are you trying to do to people?
Right.
You want people to stop coming to the beach?
Well, and we alluded to the tanning thing, and one of the things that I hear being this far north is that there are a lot of people who are like, I tan through the winter because it really helps my mood, or they'll be like, I need to get a base because I'm going to Florida in April, and they go to tanning booths, and I am just, so it's still a huge industry here. Maybe your nursing students see more that they don't consider it, but
I think some of the salons now have gotten into the spray tan now.
We do have those places as well.
But they still have the machine.
But see, I think it's like your son with putting the iPad in the crotch. I would not recommend the spray tan over the tanning bed because of precautionary principle. Like, that can't be good for you. You're spraying chemicals into your skin to change it a different color for at least a week. There's no way that's not going to be a carcinogen later.
Isn't it like makeup? I don't know.
Yeah,
I've
but
never
it tints
one,
your skin
obviously.
for 7 to 10 days.
Like, it doesn't wash off easily?
Exactly.
Ew.
Yeah, and there's no way that's better for you. I mean, how is that better for you?
I want to make being pale
cool.
Yes. I am the
you
paler
just
you
have
are,
to,
the better you're going to look when you're 90 years old anyway.
Yeah.
And so I want pale to be cool.
You just have to run with a different crowd. You have to embrace the goth in you.
Yes. And mine is, so I hear the students and I hear people say it and part of it is because, at the peak of winter, I work 7:30 to 4. And I will leave work in the dark before the sun rises and be leaving work after when I leave at 4. It's post sunset, so you just don't get any daylight. So I hear people who go to tanning booths because they're just craving that vitamin D or that light, feeling like the sun's on them. And I'm like, this is not going to work out well for you.
Well, they have lamps for that.
I know, but there are people who choose to tan to do that, and I have students who do it. Who, if I said, hey, why don't you go smoke a cigarette to feel better? They would, gross. No, that's disgusting. That gives you cancer. And then they'll go get it in the tanning booth. And I'm like, I don't understand. So I'm always trying to advocate for no tanning.
Well, this is just why I think we focus so much energy on our healthcare system and how it's inefficient and expensive and it doesn't work, those are all true. But I think the fundamental problem is we put so much energy into the treatment at any XYZ center and no attention and value on the environment that promotes health. Like sunscreen, like you're saying, like they could have sunscreen like they have the Purells everywhere. You could have sunscreen squirters everywhere. So it's like
they do
norm.
that at so the conference I go to at West actually does have sunscreen stations everywhere because it's in the mountains. Like Park City was where it originally was. Now it's in Keystone, and they actually have huge jugs of sunscreen everywhere. And I actually texted Dave because he's sort of involved with the venue a little bit, and I was like, hey, do they have sunscreen up in the VIP tent or anything? And they were like, no. And I'm like, well, you should put some up there for the people who, I would have been up there in a minute if he'd said yes. And I actually went up there anyway and asked anyway, does anyone have any sunscreen? So we went up to the tent and hung out for a while. That was part of it. But I was like, oh, it's right. It's June. We got to get our supplies out.
When I did that chalking with the kids at the school, we had a teacher appreciation week at some of our kids' school. Gretchen's younger daughter goes there too, and a bunch of kids stayed after school, and we chalked the yard for the teachers. And I was sunscreening all the kids, and this mother comes over to me. She goes, "Do you really think that we need to be doing that?" And I said, yes. Are you kidding me? Every kid lathered in sunscreen.
Yeah.
But anyway.
No, it's not an option, But
so where is your treatment status now?
So because I had the metastases that I did to my lungs and my brain, I'm considered stage 4. And that's another battle that I've had to fight, is to get people to understand that stage 4 is not what it used to be. So I can have stage 4, I can be classified as stage 4, but I can also be in long-term remission. And that's where I am right now, and I hope I'll stay that way. But, that doesn't get wiped from my record ever, even if I, live another, 80 years with no more melanoma. I'll always be stage 4 and need to be, followed, because it just has this, it has a tendency to come back. And, because of all of the advances in treatment, at this point, with a patient like me, I continue to take targeted therapy. The dosage has changed, so now I can take it every other day, which is great, because when I have to take it twice a day, and I have to fast for 3 hours each time. So, it's nice to not have to do that every day. Like today, I don't have to do that, so I can eat whenever I want to. So seriously though, if that's like the most inconvenient thing about taking my cancer treatment, I'll take it. And there's very much in the field the sense that, we can keep our patients alive until the next thing comes along. And like the immunotherapy treatment that I had for my lung tumors, the standard course of treatment has completely changed since 2014. There are other drugs out there that are like the first line thing. And so it just, the landscape keeps changing, and it can only be a good thing. I hope though that they figure out why some patients respond less well to the targeted therapy that I'm on, because I am what's called a super responder. And I have been lucky in that I've just responded so well to this treatment, but it's not the norm. It's not the case for everyone. And, we still lose people every day who it didn't work for. So.
Were you the one that just said that the redheads they've found some evidence that redheads have better immune systems?
It wasn't me.
There was a discussion at the park. I haven't pulled a PubMed search on this, but there was someone at the park that said that they'd read that recently they found that redheads have a gene
Are genetic superheroes or something.
Yeah, correlated with stronger immune response. We'll have to look into it and validate that. This is a park discussion, but it would be, it wouldn't surprise.
People say a lot of things about
it.
redheads.
Wouldn't surprise me.
They say that we have higher pain tolerance, and having gone through 2 unmedicated childbirths and somehow survived them, I guess I do, maybe.
But how would they measure that? You'd have to not be a redhead and compare.
And then when I was having these children, the nurses were like monitoring me very closely, because they're like, oh, redheads will bleed out, like you're gonna hemorrhage, and like, they were like, redheads bleed a lot, but you have really high pain tolerance, but you bleed a lot. And I'm like, I don't, what, just catch my baby. Yeah. Just whatever, just stitch me up.
Wow, interesting.
So my husband would be a bit of a redhead if he had hair. But he is one who is, like, I was rolling, like, so ticks are like a big concern for us up here, and he goes mountain biking, and he's totally changed how he mountain bikes because of ticks. So now he's wearing long pants. But then one of the things they say to do is to lint roll your body, like your skin. Uh-huh. So I'm like, I could never find a tick on you because you look like cookies and cream. And he was like, thanks. But he has so many moles and so many freckles, and he's so freckly. So I think I'm going to make him go to the dermatologist.
Yeah,
because I think he needs to go. And then I look at Willa, for instance, has this little spray of freckles across her nose that has kind of always been there, even though we sunscreen her and all of that. But like, I'm going to sunscreen you more now.
Yeah.
So the hat.
She doesn't have like, I'm really literally just freckled, like my arms up and down, my legs, like that's a different thing.
Yeah.
I haven't been as fanatical about a hat. Maxwell, I make him wear a hat because it's got the very fine hair, but James never wears hats, and he probably should. because he's very freckly and he's got that very short haircut.
Yeah.
So if
and we haven't even talked about ocular melanoma, which is like a whole different thing.
wow.
And that Oliver Sacks, actually, that's what killed him. It started with ocular melanoma. So that's, a separate screening that has to be done by an ophthalmologist. So
even you wear a hat? Because you got quite a bit of hair.
I know, it's a good question. I have a hat.
Okay, well that makes me feel better because I don't wear hats.
I wear it when I feel like I'm gonna be out in the sun quite a bit. I will wear it. I'm actually in the middle of writing an essay about this whole thing, so I don't want to sort of
okay.
spoil it. But no, I do have a hat that fits over all my hair, and I'm very good at telling other people to wear hats.
One of my things that I wanted to ask you is that
I'll tell you.
She can't hold it in.
When you are near a hospital and you see a bunch of people in scrubs outside on a break, leaning up against the building, smoking a cigarette.
Yeah.
What is that?
Hypocrisy.
Well, or I don't know, or it just, so I guess that's sort of me with hats.
It's evidence that you can know every single fact about anything, but behavior is much more difficult to change than knowledge.
That they've seen that maybe they've seen like the worst that can happen, and they're kind of feeling a little fatalistic about it.
So many theories.
I don't know. Anyway, but more to come on that, hopefully.
And one other question I had for you too was on your blog.
I do have to sign off in about a couple minutes.
Okay. It says cancer is hard, but not how you think.
Not the way you think. Oh, the tagline from my blog. So yeah, I started writing the blog when I got diagnosed with the lung metastases because until that point I thought, oh, it's melanoma, and they took it out and I'm going to be okay. And then, when it shows up in your lungs, you're like, maybe that wasn't the correct assumption. So my blog is called I'll Live, like I'll live. And so cancer is hard, but not the way you think. I guess it has a couple meanings. One was I felt like, certainly at the time in 2014, there were not as many people who knew about immunotherapy and the type of treatment I was going to go through. And they all thought I was going to go through chemo and lose my hair and be nauseous all the time. So I felt like I had a certain amount of explaining I had to do. So not the way you think, meaning you think cancer is one way, but it's a different way. It's still hard, but it's hard in another way than you think. Cancer is hard, but the way you think about it doesn't have to be hard. One of the things that was really important to me was to keep a sense of humor. And I've really tried to do that in all of my posts on Facebook and my blog posts. It was just the ridiculousness of it, and just finding myself in this place. I'm the first person in my family to get cancer, which is insane in this day and age. You'd think one of us would have managed before me, but no, it was me. And I felt like as the standard bearer for my family and getting cancer, I needed to kind of like blaze a trail and, not lose my sense of humor about it, because I still find the whole thing ridiculous. I still, a certain part of me has a hard time actually sitting with the idea that this could kill me, because so far it hasn't. I know plenty of cases that hasn't been what happened, but I still, I'm still hopeful. I'm still positive about it, and I've just been stupid lucky. So, yeah.
So we always end, I know you have to get going, we always end with a favorite thing.
Yeah.
Do you have a favorite thing to share with us?
I do, but it's embarrassing because it's something that people love to hate these days.
Oh, that's even better.
It's so obvious, but Facebook,
Yeah.
God.
Oh, I've had that as my favorite thing before. Don't worry, you're not alone.
Oh, okay. So, let me tell you why it's been so. Facebook has been great for me. I joined in 2005 when I worked in an academic library, and I wanted to be more accessible to the students. And so I put up a Facebook profile. So I've been on there for like 13 years.
That's basically since the inception.
I mean, they should be paying me. I like create so much content for them. You know, I'm waiting. On the other hand, I get mortified when I get emails from them, like with surveys, because I'm such an avid user. I'm like, I'm not doing that for you because you never paid me. But just the fact that you can create this fossil record of connections from your entire life is just amazing. You know, everyone from my very first best friend, and I have to say, like, Facebook helped us to reconnect, and we actually went away together in April for a weekend and had an awesome time, like catching up on the huge swaths of our lives that we hadn't been in close touch. One day, I all the friends in the computer from not just the community that we've been on, Gretchen, but also another one. People that I've never met, but, knowing that there are people that I can visit, when I go to another city, knowing that, that just random coincidences that'll happen. I replied to one of my friends from the computer. I replied to something she posted. This was like 5 years ago now. And a friend of hers, and she lives in Oakland, California, and a friend of hers was like, Deborah, did you used to live in such and such street, in Maryland? And I looked at her last name. I was like, oh my God, like this is the person that my parents bought the house I grew up in from in 1972.
Wow.
So we connected, and she had lived in my bedroom until she was 7. And when my parents, had the house until 2006. So I had made a photo album of like little corners and details of the house that I didn't want to forget. And I shared those with her, and we just had this incredible, and then we went out to the West Coast and we went to visit and just got along really well. And like, she and her husband were great, and they had 2 kids, and they all make music, and so do we. And it was really, really neat. And like, that never would have happened without Facebook. But I have to go because someone is coming to inspect our apartment in like half an hour.
All right. All right. Well, we will hang up with you, and we'll do our favorite things off the record. You'll be surprised by our favorite things when you get to listen.
Oh, I really want to hear.
No, that's okay. You just have to listen now. You can just fast forward to the end and listen to our favorite things, but I know you do have to get going. So
yeah, I'm sorry.
No problem. Thank you so much for carving out some time.
Good luck with your move.
Yes, good luck.
Thank you. Thanks so much. All right, looking forward.
Take care.
Bye-bye.
Take care. Bye.
What's your favorite thing?
My favorite thing goes right along with this. I may have even said it at one episode, but it's important. Environmental Work Group, ewg.org. They have a listing of every product you use and the carcinogen rating. And they just came out with, I think 2 weeks ago, a sunscreen guide for sunscreens that are effective for cancer prevention, but they don't have carcinogens in them. Because if you're lathering your kids every day, multiple times a day with sunscreen, you do have to start to think about the effect of the chemicals penetrating the skin. So it's a delicate balance. Some of them are really expensive. The one I buy is about $30 a tube. But this new guide that they just came out, there's less expensive, same quality on there. So next time I buy another one, I'm going to choose one of those. But last year, the cheapest you could get was the $30 without the carcinogens. And that is very pricey because the tube's about, 4 ounces. Yeah.
Yeah, see, and we do a lot of spray sunscreen because it kind of, what ends up happening is that it comes down to when you run out the door, is spray better than nothing? And the spray we can get on. I do take lotion. I try to do lotion when we go to the beach now, but now that I have the time to do that,
right,
it helps. But like when you're going to summer camp, they don't want to deal with lotion. They line the kids up and spray them at most summer camps. So mine is also related, and it's the hat that I mentioned, and it's by LLBean. And I was hoping, Deborah has to hear this because has adjustable, like different sizes. It's not a one size fits all, because I have a huge head.
Yeah, me
and so
too.
I have one that fits, and it has the little neck flap that you can roll up and hide if you're not using it, but if you're like out working in the garden and you really want to have the neck thing down, and it has a like the drawstring cord so it doesn't blow off. And I wear that almost every day in the summer when I go out, and it literally, a huge motivating factor was knowing Deborah's story, because we have kids the same age, and I'm so glad that she shared her story with us. And that's why I wanted to have her on, because I feel like more people need to hear that. And now I think I'm going to get off this recording and make an appointment with a dermatologist for me and for Dave, and just let him know that he's going.
I think James too. Because he's actually had an abnormal mole removed when we were in college, because I was taking health assessment and we were covering skin assessment, and his mole fit the criteria for an abnormal mole. And so anyway, we had a big debate in the family. His mom disagreed. It looks fine. And we took him in, and the doctor said, I think we should remove it because it had irregular borders and a white circle. Anyway, they removed it, and it wasn't melanoma, but it did come back abnormal. So I've been paranoid about that ever since. And
I feel like it'd be good to even have a baseline. So to have someone else checking once a year or something to look for that.
Yeah.
So if you enjoyed hearing about this story, we'll have all the links that mentioned, including the blog and the beach cabana that I love from LLBean, and all of our favorite things.
And the sunscreen guide.
If you've enjoyed listening, please tell 2 friends. You can always leave us a review on iTunes or Stitcher or other podcast services. And if you have any questions for us, you can find us on Twitter and Facebook. We have a great little Facebook group if you want to ask questions. And we hope you have a great week. Bye.
Bye.